It's good to see you on this Tuesday. Of course, we're always glad that you join us on My Doctor. My name is Winnie Lubanga, trusting that your day is coming along well. Now, it's something that you probably don't think much about, but actually the liver is a key player in your body's digestive system. And everything that you eat or drink, including medicine, actually goes through it, all the liver processes. So it's very important for you to take care of your liver to ensure that it is healthy and it can do its job. But sometimes it doesn't happen like that. Sometimes maybe you had one too many to drink, or sometimes maybe your diet is not very well, or sometimes it just happens and you do not know. So today we want to focus on the liver disease. What exactly is it, and what can it do in terms of, let's say your liver is not functioning well? What will happen to your body? Well, not to worry, because Dr. Batul is here to help us understand more about the liver disease. And of course, we'll also be joined by Anthony, who went through a liver transplant. So of course, we'll also understand his story. What happened? Did he experience any symptoms? But like we always say, we're live, so that means you can call in and ask any question that you have in regards to today's topic, and the number will be displayed on your screen in a few. But for now, before we get into the discussion, take a look at this video on the functions of the liver. But today, our point of focus is on liver disease. And we're saying just from the video, the liver performs so many functions, and it's very, very vital in our bodies. And once you do not take care of it, or when something happens, it's very easy for you to, get so many complications associated with the liver. But of course, to help us better understand on what exactly does the liver do and what happens if it doesn't function well, like I said, we have Dr. Batul and we have Anthony as well with us. And you can be part of the conversation by calling in live and asking any question or a comment, in regards to the topic. The number is 0791-478990. And of course, Dr. or Anthony will answer all your questions. So let's meet our guests for today. Good morning.
Good morning.
How are you doing this Tuesday?
Thank you, Winnie.
You're
How
well?
are you?
I am well. All right, now we'll start with you, Anthony, the only gent on set. Kindly introduce yourself.
My name is Anthony Maina, and I had a liver failure in 2016. It was a process. It didn't start in 2016.
Okay.
It took some time.
All right.
And it was successful.
Okay.
And
you're here today.
Yeah, I'm here today.
All right, to share your story, and we really appreciate that. Okay, and Dr. Batul, you're not so new on the show, but kindly introduce yourself just in case someone is tuning in today.
I'm Dr. Batul Mzefankupi. I'm a medical doctor by profession. I work for Bliss Healthcare as a medical superintendent there.
Okay,
Yeah.
Karibu sana.
Thank you very
All right, now
much.
let's go back to the basics. Of course, we've seen some of the functions, of the liver, and it's a very vital part or organ, of our bodies. And like we said, it's important that we take care of the livers, because like we said, most people, we don't really think much about it. I mean, it's in the liver too, and it's just in our bodies. All right, but of course, we'll get into how or what the things that we can do that damages our liver. But for Anthony's case, it's different. All right. So Anthony, let's go back to the basics. You said you had a liver failure, but of course it's not something that just happened like that. It was a process. So take us back.
So it just came.
Okay.
I think one of the things that was astonishing for most people when they had a liver failure, they'll all be like, but you're so young, how can it fail at this age? Because people associate liver failures with alcohol, but at least the doctors told me, even if I was an alcohol drinker, at the age at which it failed, I probably would have started drinking at probably the age of 10 and drink every day.
All right. And
But
what age were you when?
At 27.
Oh, you were 27.
Yeah.
All right. Did you experience any symptoms or?
Yeah, the funny thing was how it started was I was just normal, and then just one day I started feeling bad. I went to hospital. I was given some medication, so it started with a problem in my stomach. So what happened when I went to the doctor, they first thought it was food poisoning. Then I went on and on. I think that was back in 2011. The whole of 2011, I was just struggling with stomach issues, stomach pains, stomach upsets. I couldn't hold food anymore. So one of the doctors said I need to do some colonoscopy and endoscopy. And I was diagnosed with colitis, which is an inflammatory bowel disease. So that in the process of treating that, I started feeling better and improving. But the doctor also noticed that despite the fact that I've been given medication and the symptoms have gone away, still I wasn't adding weight because for my height I was way underweight.
Okay.
And I'd only managed to add about 2 kgs. So she wanted to investigate further. Is it the medicine that is affecting me, or what could be the problem?
Okay.
So she said she knew for sure that the medicine has an effect on the liver. So she did a test on my liver functions, and she found that they were out of they were all over the place. They were so high. So she also requested that I first stop the medication so that she can see whether the liver will improve, and it didn't.
It didn't improve.
Then that's when she decided to do an MRCP to just scan the liver and see what was happening.
Okay.
And after scanning, that's when she discovered that the ducts were blocked, everything. They were all inflamed and there wasn't good flow of bile. And she told me that's another chronic disease that I had on top of the first one.
Yes.
Yeah, that's now called primary sclerosing cholangitis.
Okay.
And she told me for that, there's nothing she could do. She can't give me any medicine to slow the process.
Yes.
She can't widen the ducts anymore because it's all over. So she told me it's just a matter of waiting and then have a transplant
Okay.
because there's nothing else that could be done. I think that was in 2013.
Okay.
And then since it was the first test that she had done, she didn't know how long it will take. She said it can take anywhere from 2 years, 3 years, 5 years, 10 years. And even in some cases, she said it can even probably just reduce on its own.
Okay.
Then come 2015, that's when now everything broke loose because my skin color turned. I was black, my eyes were yellow.
Okay.
I was itching. I couldn't do anything. I was fatigued. I would bleed. I think there was a time I was rushed in hospital in 2015 due to internal bleeding.
Okay.
I cough. If I cough hard, I just spit blood.
Okay.
And now she said, now this is
serious and
now the
something
end
needs to
stage
be
of the
done.
liver, and I
Okay.
need a transplant.
All right. Okay,
Yeah.
Anthony, before we get into the transplant case, Dr. Betu, I mean, from Anthony's story, it's not something like you were drinking too much alcohol or you were not taking care of your diet. And I mean, he's very young at that point. And talked about, stomach pains and stomach aches. And probably someone is watching us and thinking, wait, but I also have issues with my stomach and, it's not going away. So how do I know that this is something of concern? This is just a normal, stomach bug and then it will go away.
Okay, so when we talk about liver failure, we have, like you asked if you had any symptoms, we have early symptoms, whereby these early symptoms can present themselves as nausea or fatigue, diarrhea, abdominal pain. And these are not specific for liver failure actually, because any other disease or condition when it relates to the stomach can give you nausea, diarrhea, and abdominal pain. But then again, when it goes further forward and it's progressing, you always have jaundice, of which we say it's a yellowing of the white of the eye or the nails, and the change of the color of the skin, which goes darker for dark complexion, and for lighter complexion it changes yellow. And then we have it goes further, whereby you can get mental confusion also. We can get what you call he said something when whereby like he started bleeding. We have bleeding problems, the same, and then infection also start building up, because again we're looking at the functions of the liver. If the liver starting to dysfunction, whatever it was supposed to be doing, it start to go down. When it start to go down, so all the function becomes what? Malfunctions. Yes.
Okay. All right. And for Anthony's case, if I got you correctly, it was, I could say, medically induced, because it was sort of the medicine that you were using caused the liver to, to shut down. All right. But we also have like other different types of liver disease or liver conditions. So can we briefly talk about that?
Oh yeah, so first let's look at the risk factor or the causes of liver failure. We have genetic, whereby here we have Wilson disease, you know, the copper in the liver becomes, the accumulation becomes so high. We have something called hemochromatosis, whereby there's an iron overload. We have something called Budd-Chiari, whereby the vessels, you know, the vessel in the liver, they cannot function anymore. And then again, we have infection, whereby we have viral hepatitis, as such, hepatitis A, hepatitis B. We have other viral, ABV, also can, you know, lead to liver dysfunction. We have you know, bacterial infection also. Malaria can, you know, like can lead to liver dysfunction. We have genetic causes, of which I've said. We have also primary sclerosing cholangitis, you know, the one that he was diagnosed with. We have something called primary biliary cirrhosis. Also, that's an immune actually, it's not genetic. So that can cause liver failure also. So we have so many causes, I mean, so many causes that can lead to liver failure. Yes.
Okay. All right.
Also, before I forget,
Yes.
we have an idiopathic causes, whereby like the unknown, you know, a very small amount of liver failure can be caused with no reason. You know, it can occur on its own also. Yes.
Okay.
Yeah.
All right, Anthony, before we get to now where you had to go through liver transplant, which is a process on its own, of course, you'll tell us the process that you had to go through. You talked about some of the medications that you were given, and sort of it was very difficult for your liver, you know, to function well from the medication. And someone might be like, okay, so could there be anything be done? But you talked about the fact that the doctor was like, you know what, there's nothing I can do. All right, so what happened to now the condition that you had to go through colonoscopy and all that? Did it reduce or it became worse?
Maybe to just backtrack a bit, the medication that I had been given was to control the inflammatory bowel disease. And what the doctor was suspecting at that time was that the medication could be the one that is causing the liver to malfunction. But then she withdrew, but the liver did not improve. So what she concluded from that was this whole condition of the liver was there. It's just that it hadn't been detected.
Okay.
So she just, the reason why she suspected I might have an issue with the liver, it's because in some instances when you have an inflammatory bowel disease, you can also have another liver condition that the doctor is not aware of, and it might be left untreated, and the doctor was concentrating so much on the inflammatory bowel disease. Because even after I now started taking care of my liver, I still continued with the inflammatory bowel disease medication. Because now she had ruled out that it was the one that was leading to the liver issue.
Okay.
Yeah, so all that happened after that was now just monitoring the liver, seeing how it's progressing. The progression, are the results increasing? Are they reducing over time? And just watching myself. She had told me I'm not supposed to go for more than 6 months without going to the hospital, whether I'm feeling okay or not, because you can't tell with the liver. Just like one interesting thing with the liver, it's not obvious unless it now comes to the end stage. Because even when she was diagnosing, because she had seen I wasn't adding weight, some of the questions she would ask me is, do you do lots of physical activities? And I'll answer and tell her no. She'd ask me, why don't you do those? Because I'm feeling lazy and fatigued. And I think that clicked in her mind, that could be the liver issue. Then the next thing is, she would look at me and try to ask me, do you have photos of yourself before all these issues began? She discovered I was a bit lighter back then, and now I'm just becoming darker. And then the next question would be, what's the color of your urine? And for me, yellow was the normal color of urine. So I just tell her it's normal, it's normal. So one day she didn't ask, is your urine normal? She asked me, what's the color of your urine? And I told her yellow. And she asked me, from when has it been yellow? I told her, from as long as I can remember. Then that's an issue. She just clicked. Yeah, now
and that
that's
happened
an
when
issue.
you were taking water normally?
Yeah,
because
I
you know,
was
for
doing
some people
everything.
will be like, well, maybe it's because I do not take enough water. But for yours, you were taking water normally. Now, speaking of photos, we have 2 of your photos, and I want you to tell us what was happening. You know, if we can have the photos. All right, so there we go. We have 2 photos of you. Looks completely different. Someone might not tell that it's still the same person. So for the first photo, kindly tell us at what point was that?
At that first photo, that I think was in December 2015.
The one on the right.
Yeah, the one on the right. The point at which now the doctor said I don't think you can go for another 6 months without a transplant.
Mm-hmm.
And then on the other side, it's in, I think, around August 2016, December 2015, August 2016, about a month or two after the transplant.
Okay.
Yeah, so that was the level of toxin in my body
Yes.
at that time, yeah.
Okay, all right. And at that point, can you tell us how you were feeling in terms of, you talked about fatigue and not able to do so many things, but you know, you as an individual feel there's some things that you were able to do, but you cannot do. So what happened to your body at that time?
Maybe just to mention, one of the things that she said, there was this whole issue of mental, not able, it affects you mentally, because I wasn't able to process. I think from the point I landed in India to the time the transplant was being done, to me it appeared like one long, it was 2 weeks before the transplant was done, but it appeared like just one long day, because I don't even remember what was happening. I will just wake up in the morning, I'm told, let's go to hospital. We go to hospital, I'm told, move to this side. I wouldn't be very far away from the person who was taking care. Then there was one time I remember I was arguing with a nurse. Where we were arguing about something very simple, because I would have hallucinations also.
Okay.
So we were arguing about, I had seen, I don't know who I was telling I had seen, but that person was in Kenya.
Okay.
But then in my mind, I had completely seen
Seen
that
the
person,
person.
and I was sure he was here,
Okay.
and I would ask her to call him and tell him to come, because I want to talk to him. Then another thing is nightmares. There were so many nightmares. They looked so real that you start now, you can't differentiate between a dream
Reality
and what is real.
Okay.
Because a dream, maybe I'm being chased by thugs, and when I wake up, I'm convinced in that room there are thugs.
Okay.
Because I've seen them, and I've even felt them touch me, such things. So ideally, I was just at the point of almost losing my mind.
Yes.
But the doctor explained it's accumulation of toxins in the brain.
In
So
the
it's,
brain.
it's understandable.
Okay.
And then there was also amnesia. You keep forgetting, but it didn't happen a lot for me. But I would lose some instances of the day and not remember, because that one mostly happened before now the liver, after the transplant, before it started functioning, because it takes some time. Okay, it took a bit longer than it was supposed to.
All right.
I was told it went about 5 days. I still had a failed liver. So at that time, now that's where I'd lose track, because for me, I was told I was in ICU for 9 days, but I knew I was in ICU for 2 days.
For 2 days.
The other 7 days, I can't
You
remember
cannot
anything
remember it.
at all.
Okay.
Because I remember from the point when the doctor now came in, and now talked to me and asked me, how are you feeling? Are you able to do this? I remember that. When I look at the nurses, at that point when I was now in HDU, and I will tell her, you were the first nurse who attended to me.
Okay.
And she told me, no, I came on the 7th day.
Okay.
And I asked, were we talking on those other days? Yeah, you will talk, you'll even talk to your parents.
Yes.
They'd come and talk to you on the screen, but
you
I had
will
no
not-
recollection
You cannot
at all.
remember.
Yeah.
All right, Dr. Batu, before we even talk about the different types, there's so much happening.
Yeah.
You know, at the same time, like, you know, he said sometimes you don't even remember what is going and all that. So how does the brain, you know, get affected when there's like too much toxins, you know, in the body and in the brain?
So one of the function of the liver is detoxification, or rather purifying, you know, the toxin from the body. We have something called ammonia, whereby the liver comes in and breaks it down to urea, okay, and then it gets excreted. But then when the liver is not functioning anymore, the ammonia starts accumulating and accumulates such that it gets into the blood. And then this is one toxin that has that property of, you know, like escaping the barrier. We have blood-brain barrier, so it escapes that barrier, it gets into the brain. So when it gets into the brain, it's when it's starting to create a mental confusion, you know, those what do you call hallucinations, whereby they become agitated, psychotic and such that, and that we call it encephalopathy, hepatic encephalopathy. Yes.
Okay, and someone might be like, okay, fine. At that point, you are under medication, right? So someone might be like, so where do the toxins come from? Because he's on medication, so, you know, toxins, medication, they're supposed to maybe help, you know, so where do they come from, and yeah, and how do they get to the brain?
Okay, first of all, when we talk about liver, it's the one that metabolizes
Yes.
all the, you know, like everything goes through the liver to be metabolized. Even the medication, it has to go through the liver. But then again, remember, the liver, you know, like it just that was post-transplant, wasn't it?
Yeah, post-transplant.
Yeah,
the first
post-transplant.
5-7
It's starting
days.
to get, it's a new thing in the body. Then again, remember, the body, it's a foreign thing, it's starting to fight it. And that is why after transplant, you need to be taking the anti-rejection or rather post-transplant medication, so that your body should understand this one, okay, it's a foreign thing, but you know, like we're welcoming it, we should not fight it, you know, we should make it feel at home, it's gonna help us and such.
Okay.
Yes.
All right, now let's go back before transplants, all right?
Yeah.
Because there are other different types of kidney, not kidney,
Liver.
liver.
Yeah.
We talked about kidney just recently.
Yeah.
All right, let's talk about some of the other types of, you know, liver failure. For instance, there's the alcoholic and then there's the non-alcoholic
Non-alcoholic,
you know,
yes.
causes. We talk about the acute and chronic.
Yeah.
So let's start with the alcoholic and non-alcoholic.
Okay, we have alcoholic. We have 3 types of liver diseases, whereby one, it's a fatty liver, alcoholic fatty liver, and then we have acute alcoholic hepatitis. That is inflammation. Hep is the liver, and titis is the inflammation. So it's an inflammation of the liver caused by the alcohol. We also have alcoholic cirrhosis, whereby this liver, it has lost all its function and it's on the end stage. Yeah, so that's alcoholic. And then non-alcoholic, first of all, let's talk about fatty liver.
Yes, the fatty liver.
Yes, the fatty liver, which is non-alcoholic. Because in our mind, whenever we hear about fatty liver, it's always alcoholic. But it's interesting such that we say 25 to 35 of fatty liver is caused by alcohol, but it has increasing trend in non-alcoholic for the fatty liver also. And there's so many factors that does affect the non-alcoholic. One, it's fructose, you know, because like he said, whenever we hear about liver dysfunction or liver failure, it's all about, okay, you know, like aged people, not young people.
Yes.
But you see in fatty liver with non-alcoholic, you see a kid of 6 years, 7 years. But how did that happen? You know, like you give your kid maybe soda every day, or you know, like I don't know, ice cream which has a lot of fructose, you know. I mean, a kid, if comes to you and it needs, you know, that sugar rush, why don't you, I don't know, blend berries or you know, fruits and put, you know, cream in it or milk in it and give? It's more healthier than keep on giving them what you call these fizzy drinks and rather boxed juices, but it's full of fructose. So fructose here plays a major role, and it doesn't only cause liver dysfunction or liver failure, it causes other things. It causes diabetes, it causes, you know, like it has so many other effects. Yes.
Okay. All right. And talking about the alcoholic, which I think so many people are keen to know, because when you tell people you need to stop drinking, someone will be like, wait, because I talked to someone and they were like, you tell me about liver diseases and my liver might end up shutting down. But looking at my grandfather, this person has been drinking like almost all their lives and they are still okay. Their liver is still functioning well. So when you tell me to stop drinking and I look at my grandfather, he's still alive. So what will happen to
But this
his
grandfather,
liver?
how much are they drinking? Are they drinking? You know, like there's that moderation. Again, I'll have to go back to, if you ask me, please just stop drinking. But medically, we have moderation also. We say like for ladies, maybe, I don't know, not more than 1 drink or 2 drinks in a week. For guys, not more than 3 or 4. So there's that moderation. Maybe this grandfather has been drinking half a cup maybe in a month or 2 weeks. But for this person, they're, you know, like they're swimming in alcohol. So guys, moderation,
Okay.
moderation. Or rather, you know, like just
If
do
you
away
can.
with alcohol. Yes.
So completely.
Yeah.
All right, now before we go to the other type, we need to take a very short break. But of course, when we come back, we'll want to understand now for the alcoholic, how much is too much? You talked about the ladies and the gents. And then the other aspects of smoking, you know, and all that. So of course, we'll need to understand much more about that. And then during transplant, what exactly happens? How long does it take to regenerate? It's a lot, all right? So we need to take a very short break right now. But when we come back, of course, we'll have so much to discuss on the liver disease. But just in case you have any question, feel free to call in live. The number is 0791-478990, and we'll try as much as possible and answer all your questions before we end the show. So we're taking a very short break. We'll be right back with more. Stay with us. right, welcome back. Glad you're still with us. This is My Doctor, just in case you're tuning in, and our point of focus today is on liver disease. Now, before we went for break, of course, we were discussing about the different times and what usually happens when you take like one too many. But now I want us to switch gears, all right, and switch into transplant because we have limited time and we want to discuss about the transplant, what usually happens, how long does it take, and all that. So, Anthony, we'll get straight into you. How long did it take before you were okay or you received a transplant from someone else?
Long in terms of from when I got sick?
Yes, from when you got sick and then when it became serious and you needed a liver transplant. Because
transplant.
the waiting list can be long and
Yeah.
it can take some time before someone donates their
Yeah.
liver. So how long did it take for you?
So the onset of the disease, I think was in 2011 or late 2010. I'm not sure around what time because I was in campus.
All right.
And it was during long holidays, like I'd said earlier. I was just rained on, started feeling bad, thought it was because of the rain.
Okay.
The diagnosis of the first disease, I think, was in 2012.
Okay.
And then the whole of 2012, just trying to get my body back, trying to get back to my physical strength, and that not happening. Then in 2013, that's when the doctor suspected there might be an issue with the liver, and diagnosis was done in 2013.
Okay.
Then I remember 31st August, that's when things turned around,
Okay.
because it was on my birthday, but then I was admitted on that day. So because I remember when I was admitted and the nurse was asking, when's your birthday? I told her 31st, and she was, wow, you admitted on your birthday. But they were kind enough. They brought me a cake, but I couldn't eat
Oh,
of
no.
course.
because I was feeling bad. They sang
Yes.
happy birthday.
Yes.
But at that time I was in so much pain. And then when you have liver issues, you also have mood swings.
Yes.
So I was feeling like I'd kick them out of the ward.
Oh, no.
But then they're
Okay.
trying to cheer
To be
me
nice,
up.
yes.
But then I was feeling, I even felt for them because I just, later now when I'm better, I imagine the things that they go through because
Yes.
I'd be rude to them. I'd tell them whatever comes to my mind. But at that time, they try to be understanding because it's the pain in you translates into anger.
Yeah.
And it's more frustrating when you know that, when you don't know what's wrong.
The-
You don't
Yeah.
even know how to
unknown, yes.
treat it. We go to the doctor expecting the doctor will give you an answer,
Okay.
and then the doctor tells you, we can only control it, but we can't cure.
Okay.
I think that's the worst news to ever get.
Yes, to get.
Impatient, yeah.
Okay,
Yeah.
all right, and it's something interesting. Someone so close to you decided to donate
Yes,
part
yes.
of their liver. Can you tell us about that?
Yeah, so on towards the end of 2015, that's when I was told now I need a transplant.
Yeah.
And the doctor who was treating me was predominantly from the US and was referring hospitals in US. In US, I don't think living donor is very common.
Yeah.
So then they put you on the list, but then she said, you can't be put on a list,
Yeah.
you have to do it. And so she referred me to a doctor at Kenyatta who will now connect me to India, to a doctor in India who will now suggest what to be done, and they say there is living donor. At all this time, I knew about it, but I'd never even encountered someone who had gone through the same.
Yes.
So it was more of our family doing their own initial research, trying to reach out to people who have had transplants before.
Yeah.
And it was a bit hard because what we were coming across was kidney, everywhere,
Yes.
kidney. Even when you tell someone liver, they say, no,
No.
you mean kidney.
Okay.
So once we were connected with those doctors, they're the ones who advised us and told us the people who will donate. They said my brother would be the best match because of DNA, because we have the same parents. At least we will be the closest matched. But then when his BMI came back, he was a bit overweight,
Okay.
and that wouldn't. The doctor
Be
said
the
that's a
match.
high risk. It will be a really high risk.
Okay.
The next one to be suggested was my dad, but then the age had
Yes.
progressed a bit more. So the perfect one turned out to be my mom. And so she was willing. She even said deep down, she was hoping she'd be the one because
Okay.
she didn't want to see, because we're only two, she didn't want to
Yeah, the
imagine
other
me
son.
and my
Yes,
brother
and
and
your
I
brother, yeah.
in ICU. So it was really stressful for her.
Okay.
Yeah, so when everything was done, she was a perfect match. And the doctor said, since the liver is divided into two, I'd get the bigger portion because I'm the one who is recovering, and her she'd be left with the smaller portion.
Okay.
And so we started making arrangements for going to India.
Okay.
Yeah.
All right. And Dr. take us through, the process, because it's not like kidney. See, for kidney, I can just donate one and remain with one. And like we said, okay, one of the shows that, one can function with one kidney.
Yeah.
It's possible. But you see, for liver, this is one organ.
Exactly,
all right?
yeah.
And we have to share.
Exactly.
Okay, so you take one part and I take one part. What happens?
So, like, you're there wondering who's get the bigger portion
Yes,
and
and
who
who
gets the
gets the
smaller one.
smaller one.
Yeah, so for the liver, we have two lobes. We have the right lobe and we have the left lobe. The right lobe, obviously, it's bigger than the left lobe. So, ideally, when we have adult recipient, we always recommend the right lobe, to be donated. And for the kids, they remain the left lobe, and they can be donated the left lobe because it's smaller also.
Yeah.
And again, like he has said, I think because of the brother also who was kinda bigger than
Yes.
exactly. So he could not survive with the smaller one, and also So when we do the transplant, now the mom had to take the smaller one. He was given the bigger one. I'm sure that was the right lobe that you're given. How long does it take to regenerate back?
Yes.
So usually we say like 85% of the normal size get regenerated within a week. But it does take for both the donor and the recipient 8 weeks to regenerate back to the normal size.
Now, when you talk about regeneration, what
Yeah.
exactly does that mean for the liver? For both the donor and the recipient.
Yes. So regeneration is something growing back, like it's growing back. So it has that potency of growing back to the normal size, like you took one lobe, like you left the other, so it does grow back and it, like to the fullest size. So like I said, it takes approximately 8 weeks to grow to almost the full size. But then again, the recovery period here for the donor, it's about 2 months, which is lesser than like the recipient. The recipient takes a year or more than a year too for recovery. Yes, yes.
All right. Now, in terms of, because Anthony talked about he's on medication and he has to be on medication throughout.
Yeah.
Okay. So for the for the donor, is it the same case? Do they have to be on medication throughout?
Okay, so why does Anthony take medication here? He got something that is not his.
Okay.
So our body is very, how will I say, is it possessive or is it like so obsessive such that it doesn't want anything else from outside, foreign into its body. So when we have something foreign in our body, the body tends to fight it, to kick it out.
Kick it out, yes.
Yeah, exactly. So the medication here, they're anti-rejection, or rather, like they are immunosuppressant. It's to, calm that body down and tell it, okay, do not attack this.
Yeah.
We want this, like this helps our body, or rather, it can make the body not identifying this is not a foreign thing, because what fights in the body to kick something out, it's your immune system. So the medication, they are called immunosuppressant. It suppresses the immune. And that because it's immunosuppressant medication, it also suppresses your immune system. The recipient tends to have more infection because their immune system is lower than the normal people because of the medication. Yeah.
All right.
Yeah.
Okay. So for the donor, not so much on medication.
No.
All right. Now the question is, can anybody donate? There's a process that they have to go through to ensure that this is a match. And what are the chances that the body will reject the donated liver?
Okay. In post-transplant, complication, one of the last one is actually not even the last. It's there in the first one, rejection. Okay, the body can reject even with the anti-rejection medication also.
All right.
Yeah. So there is that chance of rejection. Okay. And another thing is we have complication of infection. Okay, we have complication whereby mental confusion, or rather because they can be confused or they can get into that state whereby they need psychological counseling. Also the recipient, I'm talking about the recipient here. Yes, there is a complication of infection again, like I said, because of the medication. Yes.
Okay. All right. Anthony, take us through now after the transplant. You know, were you able to go back and do the things that you used to do, or now you have to be very, you know, cautious, or what usually happens? I mean, compared before and after transplant.
Maybe more of a before. The before that I have is when I was sick,
Okay.
because the period I was sick was so long. So I don't remember a period before I was sick, because it's some years. But looking into all that, one of the things that maybe I could mention is immediately after the transplant, there is a fear of going back, because once you're through that and you've survived it, you're like, I made it, I don't want to go back there. So you watch everything. I think for the first 3 weeks, it was the recommendation of the doctor. After now I left hospital, I stayed in hospital admitted for 21 days. I could not leave the premise. Then when I left, I would walk around, but not so much. I'd just walk, minimal walking. And whenever anyone came into the room, I had to wear a mask and just stay away from everyone for about another 1 month. Then the other 1 month, I will interact with people. But if you come, you have to first disinfect yourself. You have to clean up yourself completely. And I wouldn't go where other people are. It's people to come to me. But once you come to the house, go clean up your hands. If you had some clothes, change your clothing. And then we'd sit together for another one. I think for now, this was now towards the last month as I was coming back now to Kenya, because I stayed in India for a total of 3.5 months. But even after I came here, I was avoiding public places for about 6 months. You can't walk because the immunosuppressants are so high, and any risk of infection at that time could be so bad. Then after those 6 months, now I went back to India, had some more tests. And then now, I think after about an year, that's when I was told I could do everything everyone else is doing, but just observe hygiene. If I'm served first, like as of now, I just don't take water from anywhere. It's either boiled or it's bottled, distilled, but I can't just go to the tap and take water.
Take some water.
I've not had an encounter where I've had an infection, but the doctor has told me even now, if I get an infection, I wouldn't take antibiotics like the other people. The first thing is they'd have to get rid of the immunosuppressants and hope that by that time my liver won't fail by the time they're done fighting the disease. And then it can go to the level that I'd have to take the antibiotics directly into the blood instead of so that's the major change that is there. But in terms of diet, it's just avoiding foods that would overwork the liver. Case in point, alcohol is one of the biggest no for that. And other foods that are being food that will be broken down in the liver. But with time, even your body just adjusts itself. Because like now, if you were to give me soda, I think I'd get a headache for like, I don't know for how long.
Okay. So no more fries, no more one nyama choma for you.
No, that's not bad.
You can still take
that's
it.
Nyama.
Okay, so what
because
exactly?
It's protein.
Yes.
By the way, that's a bigger difference between kidney. Kidney, they are told to avoid meat.
To avoid it.
But then liver, you're told to have a high protein diet.
Okay. So which one are you supposed to completely avoid?
Completely avoid. First, it's alcohol.
Yes.
And foods that what was the term that the doctor?
Sugars.
Yeah, artificial. Yeah.
Okay.
But those ones, because of the medicine I'm taking, if I take, and most of my friends don't understand this, if I take anything that has sugar, my sugar levels go up, really up, like someone who is diabetic. But I'm not.
Yes.
I get to the point I get hangovered, like someone who took alcohol the previous day. So even the taste of sugar in my mouth right now.
Yes.
Actually, there's a time someone served me soda, and I started feeling bad, even before I'd taken it, because it's all mental.
Oh, wow.
It's conditional now.
Yeah. So I rarely take. If I have to take soda somewhere it's being served, I just ask for sugar-free. Although I hear there's
still some amount of sugar in there.
Yeah, but then the funny thing, when I took that once, it didn't. It's not mental. This one. It
Okay.
was actually the sugar didn't go up. I don't know what they put there.
Okay.
But the sugar didn't rise.
It didn't go up.
Yeah, yeah.
Okay. All right. Now talking about donors, you see, I think before someone gives you part of their liver, I think it's one of the most noble things to do because not everybody can do it. But the question is, does it only have to be a living donor, or you can get it? Are there different types of donors that can donate their liver?
Okay, mainly we have 3 types of donors,
Okay.
one of which is a living donor. This one, I think it's better. Usually when it happens to a living donor, it's either a loved one, a family, like a very close friend. Because I think it's a sacrifice one is making to give you the part of their body and for that matter, an organ, it is a very honorable act to do. And then we have other 2 whereby first we have orthotopic donor. Here we are talking about a deceased, a deceased donor, whereby you get a whole liver to yourself. Okay, not you, but the recipient, they get a whole liver to themselves.
Yes.
And then we have a split, kind of donor, whereby a deceased, I talked about we have 2 lobes. For the liver, we have a right and the left lobe. So ideally, when these lobes are being divided into 2, one it should be going to, a child recipient, and the right one it should go to an adult recipient. So split, it's when one deceased body and it donates to 2 recipients. Yes.
Okay. All right. And talking about the donors, what are some of the risks, that probably could happen, or sort of to say, there's sort of it's a complication that can happen to the donor, after donating their liver?
Okay, before donating anything, I mean organ or rather blood, the donor should also go through some processes. First of all, it should be, they should be checked if their health is good enough, first to undergo that surgery, 2 to undergo the recovery period. Another thing, they should not be having transmitting diseases also, or rather maybe this donor has cancer and they want to donate. So for the donor, they have to be checked the background or the underlying condition before they are able to donate any organ whatsoever.
Okay.
Yes.
All right, but nothing will change after the donation and everything. Nothing will happen to them.
For as long as the background check is cleared, really, they're good, they're cleared.
All right. And how long do you say they take their medication, that is the donors, before they're now okay and the liver has regenerated and they can go on with their lives?
Okay, like I said, for regeneration, it takes about 8 weeks for both, of course. Again, with this 8 weeks, it's not completely. It's that bigger amount size they have reached, almost complete. So it's about their, it's not a lifelong like in the recipient. In recipient, it's lifelong, and it's an anti-rejection medication, yes.
Okay, all right, so it's just for some time and then they're back to normal.
Yeah.
Now, on the recipient side, are there complications that might arise after the transplant? We talked about the body might or might not reject the liver. What are some other complications that might arise after the transplant?
First is infection.
All right.
I mean, majorly it's rejection itself. I think the biggest loss is when you're getting an organ and then your body rejects it. So that's a major complication, rejection of that organ. We have infection. Again, we say immunosuppressant, it does suppresses your immune system, so you're more prone to an infection. For you, a flu, it can get, it can take 3 days, mostly a week, but for them, it can be a life-threatening kind of infection whereby they will need to be hospitalized. And we have mental, confusion also. We have it in the recipient. We have, in the long term, of course, we have again the recurrence of the failure again.
Yes.
Okay, so he said something about it's you're giving this organ, but then again, it's gonna fail again. In long term.
Yeah.
So I think that is the major complication for it. Yeah.
Okay.
Yeah.
All right. Okay. Let's get that clear. It will fail at some point.
Yeah,
It is
can.
a long term. It can.
Okay.
It
Oh,
will
it
not.
can. There's
It
that
can. Yeah,
possibility.
it can. Yeah.
Okay.
We have bleeding complication also in the recipient. We have blood clots. We have biliary complication whereby, like after the surgery, we can have leakage also in that point of like attachment. Yes. Yes.
Okay.
Those are some of complication in the recipient
Okay.
post transplant.
Post transplant.
Yes.
Okay. All right. And then we mentioned this. When it comes to when someone wants to donate part of their liver, you mentioned some of the things that, of course, the procedure that they have to go through. They have to be checked, on their weight and all that. Let's talk about that indeed, because probably someone is watching us and they just tuned in right now and they're like, oh wait, but I want to donate part of my liver. So what are some of the processes that I have to go through? Either of you can take that.
Okay. Internationally, I will say, we always say for donors, okay, we have living and then we have deceased. For deceased, obviously, there are those people who, give their organs. They say, prior to death, they'll be like, we have a card where we sign the donor card, where you sign after, in case of my death, like my organs can be donated to recipient for as long as, they're healthy and they're not diseased. Yes.
Okay.
Yeah. For the living ones, again, it's that process, yeah? I mean, the procedure, you have to go talk to your doctors. There's psychological counseling, of course, and for the recipient, there's financial counseling, because how are they going to, be able to maintain the post-transplant medication?
Yes.
It's not a small burden, it's a heavy burden, actually. Do they have insurance to cover for that, we talk about what you call psychological counseling. We talk about psychological counseling. We talk about when they go into that mental state whereby it's not depression per se, but there's that state whereby you need, to be counseled also mentally. You need to be counseled also, and the donor also need to be counseled mentally. Yeah, I will be saying yes, I want to donate, but then again, when it reaches there,
you freak out.
I'll be like, oh, okay, no, yeah. So you need to be counseled mentally also.
Okay.
Yes.
All right. Okay. And briefly, because we need to end the show right now, so Anthony, I think we'll finish with you. Having gone through this process, of course, right now you have a better understanding of how important our liver is, because most of the time, especially for the alcoholic liver disease, we're always told don't take too much alcohol or reduce, but then again you're like, well, it has not happened, so I am okay. All right. So very briefly, what would you say are the best ways to prevent any form of liver disease before we even get to now liver failure where you need a transplant?
The best ways to prevent liver disease, it's just be mindful of what you take. What you take in, the more toxins you take, the more your liver will be worked. Yeah. And from what I went through, and from what even the doctors explained as the liver was getting damaged, what happens, it doesn't get damaged by one night drinking or just a days of eating the wrong things. She was explaining that when you get to the point of cirrhosis, you start by the liver gets damaged, it repairs itself. Then it gets damaged again, it repairs itself. Then it gets to a point where it's repaired itself so many times that it can't repair itself anymore.
Yes.
So you might be drinking and you're okay today, but then in the long run, you're going towards liver cirrhosis.
All right. Okay. So unfortunately, we have to say goodbye. Thank you so much, both of you, for coming over today, and of course helping us understand what liver disease is all about and liver failure and all about the transplant process. So Anthony, wish you all the best. Thank you so much for coming over.
And not to eat wild mushrooms.
They're not supposed to eat wild mushrooms. Okay. All right. And thank you so much for staying with us. I believe that you've learned a lot as far as liver disease is concerned. And like Anthony said, be mindful of what you're doing, what you're eating, because you might not see the complications now, but it might happen later. So it's better to prevent than to be sorry about it later on. So my name is Winnie Lubambe. Thank you so much for your time. We'll see you again tomorrow when we'll be discussing congenital heart disease. So you want to stay tuned for that. But for now, it's a goodbye from us. God bless. See you tomorrow.